Another product that's really popular with people because it's portable and they use only as much nicotine replacement as they wish to is the gum. It's been around for quite a long time, and people can choose different strengths based again on how many cigarettes they were smoking. The box I have in front of me contains 2 milligrams of nicotine per piece of gum. It's available also in 1 milligram and 4 milligram. We have to consider that alternative strengths might be available if you're viewing this video later than the time that we produced it. So we should tell our clients to be aware of the number of milligrams they wish to chew. The gum comes packaged for safety in either a foil package or in little tubes with a tight plastic lid that fit on the top. The choice of the packaging might be important to a client because it can make noise. And if someone wants to use it when they're on the telephone or to use it discreetly when they're in front of other people, they might find the noise to be kind of irritating of different brands. So they should find a brand that they like. The way that the gum is used is that it is chewed, but in a slightly different manner than regular gum. So I'm going to remove a piece of gum from the safe foil packaging. I have to break the paper on the back first. And the manufacturer has designed this one so that the foil peels. That's to make sure that children or small animals would have difficulty opening the package. There I have a piece of gum, and I would put it in my mouth and bite down on it 2 or 3 times until I can feel a tingly feeling or a peppery taste. That lets me know that the nicotine is being released. And then I'll bite down twice and slide it into the pocket here between my cheek and gum. When I make the position of the gum in there, it's accessible to all the blood vessels that are there, and the nicotine is slowly released into my saliva, and it's absorbed by all the blood vessels in my mouth, so I get gradual release of nicotine. It takes about 20 minutes before I have absorbed the nicotine out of here, so people need to be prepared to use it perhaps ahead of the time that they know they're going to have a problem with cravings. Once I put the piece of gum in my mouth and chew it for 20 minutes, I can decide that I've had enough of the piece of gum, or at any time I could simply spit the piece of gum out. And I might want to have a tissue with me if I was in a meeting or wanted to be discreet about it, place it inside the chewed gum inside the tissue, and then I could place the tissue inside a hard plastic container that's sealed, so that if a child or a small animal had access to it, because it smells like food or candy, they wouldn't be able to chew it because there's still nicotine in there that might be harmful to them. I also want to be careful not to eat or drink anything that would make my mouth an acid environment. The most common things that would do that would be coffee, tea, juice, or pop. Those things make the environment in my mouth acid, they zap all the nicotine out of the gum, and I end up swallowing it. The side effects from chewing the nicotine gum can be a sore mouth, as you can imagine. The gum itself is very grainy. It feels like it has sand in it maybe. That's how the drug is bound onto the gum. So some people might get mouth sores, might make my mouth dry, might make my mouth sore, or some people will experience hiccups if they swallow too much of the nicotine. When I have the piece of gum in my mouth and I'm chewing it in that manner with bite, and then park in my cheek, I can have gum releasing nicotine for about 20 minutes so that I'm able to get a break of time with the nicotine in my system that makes me feel as I might have if I was having a cigarette. We also want to be aware that the gum for some people might bother dental fillings, crowns, or dentures if they had them. It can irritate and cause mouth sores. So not everyone is going to find that the gum is a useful thing for them to use, and they might have to change to a different form of nicotine replacement therapy.